Well, in 1920, when our organization was founded, it was to take care of the sick and needy in the city of St. Augustine and in the county of St. Johns. And one of the things that excites me about this organization is that even with all of the changes in healthcare, that central core mission of being able to take care of people and being patient-focused in what we do, and also having a charitable mission in that. I'm just pleased to say that our organization has actually never discharged anyone for purely financial reasons. And that's a very good thing, and I think one of the reasons why the staff is so excited about their work. Not only do they get to deliver care and see the results of that, but they know there's an organization behind them that takes the charitable mission and purpose of this calling seriously. We give about $2 million a year in total charitable and uncompensated care and services. And every year we try to grow that to an even larger amount.
When I give a tour of the facility, what I tell them is I don't care how beautiful a building is, if the staff and the people that work with their loved ones every day do not care, well, the building makes no difference. They're in their last years of life, and every day is a day that should count for those people. Every time I walk through the facility and I see these people, every one of these people have contributed something to this world, and they've got a history. You can go out and raise money for young people, but you go and try raising money for old people who can't take care of themselves. People just aren't that interested. They don't mean to be that way. It's just that the young people represents something that's exciting and their future's ahead of them, where these people, their future is behind them, if you will. It's our job here to make sure that every day counts.
The fun part of my job is seeing people in every aspect. We can see people from when they need us to when they don't need us, and then we see them again in the community after the fact, who's saying, oh, look at how great I'm doing. In fact, even last night when we did a lecture at the library, we had a family member who said, my dad, who's 94, just got discharged home a month and a half ago from you guys, and he's doing great. I love seeing stuff like that. It makes it really, really fun to get up and come to work every day with that.
I can't ask for more when it comes to my mom's care, but the most important thing is that my mom is considered a regular person, human being, and treated with a lot of respect and admiration, and she's comfortable here, so that's what's important to me.
You gonna sing us a song? I need about the beer, Mom, I need about the beer.
And the staff is always, no matter who it is always acknowledges me. So I'm totally content here, and she'll probably stay here forever.
Well, I think one thing that makes our organization different, not only because of its charitable mission and purpose, but different as a healthcare provider, is that we approach the care we give to our residents and to our patients on what's called a continuum of care basis. Healthcare is a strange thing. It's expensive, but it's less expensive if you can deliver it in the least institutional setting. So one of the reasons we have 2 assisted living facilities, a skilled rehab program, outpatient rehab, skilled nursing, long-term care, and also home health, is so then we can match the patient's needs with the program we have and deliver that in the most cost-effective manner. But another thing happens when you approach healthcare on a continuum basis. The patients are always more satisfied. Everybody would want to get the care they can get and return back home or back to their own apartment with as much functionality and quality of life as possible. And really the flexibility of a continuum of care approach allows us to do that not only in the most cost-effective manner, but in the manner that is most satisfying to the patients.
Patience is a virtue when you're working in this field. If you don't have patience, you shouldn't even be bothered with it. I love when you sit and talk to the residents. They have such good stories to tell you. You can always learn something from them, as well as them learning something from you. But I love what I do.
There's not a better group of people anywhere than right here. And I mean that from the bottom of my heart. Every single one of them are awesome. And the way they care for each other and the patients, the residents, it's unbelievable. And God's blessed me for being able to be here, because I'm the person that reaps the rewards of having relationships.
We had two problems. We wanted the best facility that we could find in the area where the family would have access. And we also had two different levels of medical requirements between my stepdad and my mom. And fortunately, we didn't have to decide between those aspects of the problem, that we believed quickly that Pavilion and BayView had the best of both. And there was no compromise that we had to make, and the staff has borne that out ever since. It's just been a great experience.
One of the things I'm really excited about when it comes to our organization is that there are some things that we do that we actually do make some money on. And we take those funds and combine it with the contributions from others, and it allows us to make what we call our 100% promise. 100% of the expenditures of all donated funds are spent here locally. None of it is sent out of the community. 100% of it is raised voluntarily. We don't have a staff of people that are devoted only to fundraising. We have some folks that are part of the St.Johns Welfare Federation that help facilitate that, but we don't have to pay a staff in order to raise those funds. And then 100% of it goes directly to the charitable and uncompensated care. No money is used for overhead or the payment of executive salaries. So we feel like we give a very strong and high donor value to the contributions. And that's really because of the vision of our board of directors and the energetic and good work of our employees that allow us to fulfill that mission and purpose in this community.
My name is Otis Mason. I'm a retired educator here in St. Johns County. I have served on the Buckingham Smith board now for approximately 10 years, and we are one of the funding sources for the Welfare Federation. And of course, we're very familiar with the operation of the BayView facility, and we think it is one of the most respected and one of the most contributing agencies that we have dealt with over the years.
It's very rewarding for me to work with people that have had injuries or strokes, and they come in the building and they're often depressed and down in the dumps, and one of the jobs we have is to let them know that there's a light at the end of the tunnel. And sometimes we have to convince them that light's not a train.
That's Charlie, how are you? I'm ready to kick you back to the curb just as soon as we can, you know that.
One of the things that keeps me here at BayView is that from the administration on down, it's patient-centered. I've worked at facilities where the primary motivation was profit, and getting materials and supplies for the patients has been difficult at a lot of places. And here we have the flexibility to work with what the patient really needs and focus on their recovery. And in the long run, it works out much better for me as a clinician and also the patients in maximizing their health benefits.
100% the patient is first. It's everybody's focus is on the patient, making them better as quick as they can, and to make it a fun atmosphere, not just kind of running through the motion.
Restaurant.
Ooh, and what kind of restaurant would it be? Italian.
Well, it'll be a combo.
Oh, okay.
Just all kinds of food.
We'll have to get you cooking more.
Yeah?
It's just focused on them.
This is the best place for the therapy for me. They did wonders for me before, so I'm hoping they'll be able to get me back on my feet again. I'm sure they will. I do have a caregiver that lives with me, and she can't give me the therapy that I need right now because I need to learn to walk all over again. So this is like my second home, and I know most of the personnel here, so they're wonderful to me. They make me feel like a queen when I'm here, so believe me, you'll always come back to a place where they make you feel good.
Great job. That was fantastic.
3 times today.
I know. She's on the road to recovery.
Yep. It hurts, but it works.
One more time each side.
That's what counts. I can't believe how wonderful they all are. And not only that, the food's good. So you can't beat that.
I really love my work. In fact, it seems a little strange to even call it work. I get to be a part of a team of people that are very dedicated to caring for folks, for working as an interdisciplinary team to make sure that the quality of care is top-notch. I get to work with community leaders and board members that are committed to our mission and purpose, and it is just a privilege and a blessing to be a part of this.